This is it. Two people. Biggest Loser. On your mark. Get set. Go.
And here we go with another inspiring season of The Biggest Loser. It starts tonight on KPRC Local 2 o'clock at Local 2. And there is a Houston woman on the show this year. Montina is a background vocalist for Beyonce who wants to look as good as she sounds. Get to know Montina and all the other contestants on the 2-hour premiere. It starts at 7 o'clock this evening. You know, it's no wonder that The Biggest Loser is so popular with our audience, with so many people, with our country's obesity rate skyrocketing. Lots of people are doing whatever they can to conquer their weight issues.
But what if you're just carrying a few extra pounds? Well, according to several new studies, that may actually be healthier for you. These two recent studies by the CDC found that people with a body mass index in the overweight range are no more likely to die from cancer or cardiovascular disease. And another study out of Australia found that overweight people in their 70s were less likely to die in the next 10 years of their life than those who are normal weight. So we wanted a physician's take on this. We've decided to ask Dr. Drshelenalaljiaesthetics to join us from her wellness and medical spa in Sugar Land. Dr. Shel, as you're called in your office, we thank you for being with us today.
Great to be here.
You know, as a doctor, I'm sure that you would not advise people to remain 10 or 15 pounds heavier than the recommended weight. But, I mean, can you see some credibility in these studies, or are they just way off base?
Well, Dominique, I happen to have read those studies, but as we all know, that there are many studies that say just the contrary. So one of those studies, as you know, spoke about people over the age of 70. But a lot of the younger population, a lot of the different lifestyle factors, predisposing factors, as well as existing medical conditions really play a big role. And so you really need to look at all of those things to look at health and wellness, not just a number on the scale, which is why I always tell my patients, really pay attention to total wellness from the inside out. We take into account your diet, your exercise, and many other lifestyle factors, giving you that mind-body balance and making you truly healthy, not just focusing on a number on the scale.
Dr. Shel, let's talk about some of the risk factors of carrying extra weight. I mean, we know that there is a direct correlation with extra weight and diabetes, for instance.
Absolutely. And we probably all know that medical costs in this country associated with obesity as well as other excessive weight issues range about $147 million in the last couple of years, per year that is. And those costs are directly associated with things such as cardiovascular disease that is higher in patients with obesity or excessive weight, other high blood pressure issues, diabetes, strokes, certain types of cancers, as well as sleep apnea. So there are many things that are associated with having excess weight on board.
As a doctor, are you concerned at all if, you know, people hear these studies and they think, oh, phew, you know, I've got a clean bill of health, I can keep on that extra 10 or 20 pounds. I mean, is that cause for concern?
It is, because I like to tell the viewers, go out and get active. It's not the number on the scale. It's how the weight is distributed. You need to look at your BMI, which is the body mass index, which if it's over 25, you're overweight, and if it's over 30, you're truly obese. You also want to look at how that fat is distributed, how much % fat you have versus the % lean body muscle mass. Also, and you know, this is most important, look at the lifestyle factors. We need to really let our viewers know to stop smoking. Eat a healthy, nutritious diet with 5 to 6 meals per day. Drink plenty of water. Get plenty of sleep. Maintain an active lifestyle with having some cardio activity as well as resistance activity, as well as reduce your stress. We are all a very stressful society, and we need to reduce that with yoga, meditation, other things. Sleep 7 to 8 hours a night, and most of all, get your thyroid, your hormones, as well as your nutrients in good, healthy balance. And if our viewers do all of that, Dominique, I think they will be as healthy as they can be.
You know, Dr. Shel, we could spend an entire newscast talking about all this. It's so informative. Thank you for your time today. We greatly appreciate it.
It's my pleasure.
Thank you, my dear.